Hey everyone, so here's a quick overview about gynecological tumors in the United States and across the world. You'll get a lot of questions that will just really require for you to know what is the most prevalent, which ones are the ones that account for the most deaths, and also age ranges. So based off of those three things and other things, depends the way you look at questions, you can kind of get the answer right as far as what they have. So here you can see CEO. Just think of a CEO, right? Like a leader of a company. So C is going to be the one with the best prognosis. See the smiley face? E, endometrial, is going to have an okay prognosis. Ovarian, worst prognosis. Who gets these three? Cervical cancer. You're thinking about a young woman in the United States, maybe not in the United States, but here I put a tiny American flag saying she may or may not be in the United States. Low incidence in the United States. But of course, now we have our HPV vaccination. It's hopefully going to even bring that down even further. But if you do have a cervical cancer patient, she's probably going to be less than 45, good prognosis. And let's see, so if we move over here, endometrial cancer, 55 years old. So quiz question for you, what is the average age of onset for menopause? Well, it's 51. So 51 would be right over here. So if you have a 55-year-old, she's probably started menopause or about to. So Julianne Moore, she looks great, but she is 55 years old, or at least she was recently. Whenever I Googled 55-year-old celebrity to put on this, Julianne Moore came up. So she looks great, but she's probably about to start menopause. Julianne Moore. Endometrial cancer, high incidence in the United States. Okay prognosis. 65, poor prognosis. You're thinking of an old woman probably coming into the hospital from secondary effects of ovarian cancer. There's a lot of secondary, what I like to consider as mass effects. I'll go over that in a separate page, but she's going to have other things going on. You don't really have a patient that presents saying, hey, I have ovarian cancer. She's going to have a lot of other things, whether it's urinary issues and the like. So this is going to be your worst prognosis. And there's an increased incidence across the world. And over here I have some survival statistics. 5-year survival for stage 1 epithelial cancer is going to be 99%. 5-year survival for advanced tumors is about 20%. So this second one here is going to be about what you're looking at for a grandma. Anyways, well, let me know if that helped, and if you have any questions, just let me know.